Hello, everyone. My name is Christina, and along with Nusheen, Fabiola, and Jeffin, our hot topic in global health is non-communicable diseases. In an overview of our table of content, Nusheen will start us off with hot topics on why NCDs are significant. Um, Jeffin will tackle variabilities across the World Bank region, while I covered the global frameworks and actions of NCDs, and Fabiola will critique the global system. While wrapping up everything will be Jeffin with the priority areas of actions. Without further ado, Nasheen, you can start us off.
Thank you, Christina. Hi, everyone. I'm Nosheen, and I will be talking about significance of non-communicable diseases, or NCDs, as a hot topic in global health. According to WHO and CDC, NCDs, also known as chronic diseases, are the result of combination of genetic, physiological, environmental, and behavioral factors. They have long latency periods, not transmissible from person to person, characterized by prolonged course, and mostly ends in functional impairment or disability. The current 5x5 approach to NCDs favored by WHO focuses on 5 diseases: cardiovascular diseases, cancer, diabetes, chronic respiratory diseases, and mental health, and 5 risk factors such as tobacco use, unhealthy diets, physical inactivity, harmful use of alcohol, air pollution, as all these risk factors increases the risk of dying from NCDs. Now, why NCDs are significant as a hot topic? NCDs have massive emotional, societal, and economic consequences, since those affected are generally at the peak of their productive careers, and their premature death or reduced productivity as a result of long-term illness or chronic disability might cause them and their dependents to become impoverished. NCDs are leading causes of death and disability globally. According to WHO, NCDs kill 41 million people each year, and that's 71% of all deaths globally. Cardiovascular diseases account for most NCD deaths, about 17.9 million deaths annually. This is followed by 9.3 million deaths due to cancer. Every 2 seconds, a person dies prematurely from NCD, and 800,000 people die from suicide. Urbanization and unhealthy lifestyle as a result of social, economic, and cultural factors further aggravates the NCD epidemic and killing 15 million people between 30 and 70 years of age. Most premature deaths and suffering from NCDs are preventable. A WHO report shows that investment in control of NCD will generate US $350 billion through averted health costs and increased productivity, and save 8.2 million lives by 2030 in world's poorest countries. According to WHO, for every $1 invested in scaling up actions to address NCDs in low and lower middle income countries, there will be a return to society of at least $7 in increased employment, productivity, and longer life. According to Lancet, COVID-19 and NCDs combine to generate a syndemic, defined as parallel epidemics of health issues that interact synergistically and mutually strengthen each other. The pandemic of COVID-19 is taking place against the backdrop of a continually expanding NCD burden. Also, high rates of NCDs in low and middle income countries cause poverty and hinder economic development. If NCDs continue to grow at the same pace, NCDs are estimated to cause a cumulative loss of output of $47 trillion between 2011 and 2030. Here are some newspaper clippings. UN Health Agency declares that NCDs are killing more people than ever before. And according to economists, are we facing a non-communicable disease pandemic? 90% of all New Zealand deaths are the result of modifiable risk factors. Another newspaper clipping shows, according to WHO, the need for palliative care is expected to nearly double by 2060. And WHO report says alcohol abuse kills 3 million people a year. Here are some recent reports. The World Health Summit, one of the world's most important strategic forums for global health, called for redirections of budgets to build resilient health systems with reliable NCD service delivery. The Federal Trade Commission, in its annual cigarette report, said that cigarette sales increased for the first time in 20 years. The International Diabetes Federation has released new figures showing that 537 million adults are now living with diabetes worldwide, a rise of 16% since the previous estimates in 2019. According to 2022, the State of Mental Health in America report, nearly 50 million Americans, almost 20%, are experiencing a mental illness. Over half of the adults with mental illness do not receive treatment, totaling over 27 million adults. And this report confirms the trend that mental health in the US continues to get worse. And in the end, the US Food and Drug Administration announces it has authorized the marketing of its first set of electronic nicotine delivery systems. And that report was swiftly condemned by American Lung Association, saying this throws young people under the bus.
The next topic we want to discuss is non-communicable disease variability across World Bank regions. Just to provide a general overview, according to a study completed by the World Health Organization in 2008, NCDs contributed to about 36 million deaths globally, which accounts for about 63% of deaths from a total of 57 million deaths in the world. According to a study completed by the Global Burden of Disease in 2010, it was estimated that mortality due to NCDs increased from 57% of total mortality in 1990 to about 65% in 2010. This 8% increase shows we are heading in the opposite direction of our goal. The graph on the left side of the screen shows the comparison of the percent of deaths between NCDs, communicable diseases, and maternal, perinatal, and nutritional conditions and injuries in 2008. As shown, the percentage of deaths caused by NCDs are about double those of communicable diseases and about 6 times more than injuries. Globally, the lowest risks of NCD mortality in 2016 were seen in high-income countries in Asia-Pacific, Western Europe, Australia, and in Canada. The highest risks of dying from NCDs were observed in low-income and middle-income countries, especially in sub-Saharan Africa for men, in Central Asia and Eastern Europe. Non-communicable diseases are the leading causes of ill health in the world and account for 7 of 10 worldwide deaths. NCD mortality is higher in low-income and middle-income countries, and at least in high-income countries in people with lower socioeconomic status, making NCDs an important obstacle to reducing global and national health inequalities. The staggering toll of non-communicable diseases and premature mortality in low and middle-income countries sometimes even surprises those who suppose that mortality in these countries is still dominated by maternal and child deaths and deaths due to infectious diseases. Generally, I feel there is a slight predisposition for people to believe that non-communicable disease mortality rates and prevalence rates are higher in first world countries as compared to third world countries. But what we've seen is that it's actually based on proportions and numbers of population size. So just looking at the graph at the bottom of this slide, we can see that mortality from NCDs is concentrated between the continent of Africa, as well as the continent of Asia. But proportional mortality from NCDs is actually higher in the higher income countries when compared to low and middle income countries, because high income countries have a lower burden of maternal and child deaths and deaths due to infectious diseases. However, the absolute number of deaths due to NCDs is higher in the low and middle income countries, largely due to their larger populations. Given that there is no single meaning for global health governance, according to the Lancet, global health is defined as a multifaceted area of study, research, and practices that places priority in improving health and achieving health equity for all, as global governments in the systematic way to manage and utilize formal and informal institution, rules, and processes by state, intergovernmental organization, and non-state actors to deal with health challenges that require cross-border collective actions in order to address the issues effectively. Such is the case on the severity of non-communicable disease, which have become a major concern worldwide, and despite increased attention over the past decade, progress towards addressing NCDs have been slow, as lack of bold policy commitments have been suggested as one of the contributors to limiting progress in NCD prevention and management. However, with employed policies from key global actors, bilateral, multilateral, and non-for-profit organizations, this burden can no longer be undermined. As global response to addressing NCDs have risen in the global agenda, this preventable disease can be enabling if the healthcare system can respond more effectively and equitably to the healthcare needs of people with NCD, and influencing public policies in sectors outside of the health that can tackle these shared risk factors such as tobacco use, unhealthy diet, physical activity, and the harmful use of alcohol. In addition, with members of state and government recognizing this vast body of work and acknowledging regarding the preventability of NCDs, this introduces an immense opportunity for global action and control of it. Therefore, with heads of states and government committing themselves to the UN political declaration of NCDs, will establish and strengthen multi-sectoral national policies and plans for the prevention and control of NCDs, as development and national target and indicators based on the high-level meeting of the UN General Assembly on NCD held in 2011, 2014, and 2018 highlighted important policy development and changes built on what's already been achieved through the implementation of the 2008 to 2013 Action Plan. In addition, with new roadmaps of policy options, the Global Action Plan for the Prevention and Control of NCDs for 2013 through 2020 and NCD Global Monitoring Framework in 2013 have incorporated NCDs into the Sustainable Development Goal, which will contribute to the progress on the 9 global NCD targets to be attained in 2025, including 25 relative reduction in premature mortality from NCDs through prevention and treatment and promote mental health and well-being. Furthermore, to realize these commitments, who endorsed by WHA will start tracking implementation of the Global Action Plan through monitoring and reporting on the attainment of the 9 global target from NCDs by 2015 against a baseline in 2010 global monitoring framework, as governmental, non-governmental, bilateral, multilateral, and not-for-profit organizations are urged to set national NCDs target for 2025 based on national circumstances, develop multi-sectional national NCD plans to reduce exposure to risk factors and enable health system to respond in order to reach these national targets in 2025, and to measure results taking into account the Global Health Action Plan. In acknowledging the Rio Political Declaration on Social Determinants of Health adopted by the World Conference on Social Determinants of Health and endorsed by the 65th World Health Assembly, and recognizing that health equity is shared responsibility and require engagement of all sectors and government, all segments of society, and all members of the international community in an all for equity and health for all global action. Regional framework providing strategic interventions and indicators to assess country progress in area of governance, prevention, and reduction of risk factors, surveillance, and health systems have been targeted. In global health governance, setting the national target for 2025 in 2013, considering the 9 global targets and establishing a multi-sectoral plan and setting up national targets and indicators for 2025 were based on national situation and WHO guidance. In area of prevention and reduction of risk factors, accelerating implementation of the WHO framework, Convention of Tobacco Control, and ratifying the protocol to eliminate illicit trade in tobacco products. Ensure healthy nutrition in early life and childhood, including breastfeeding and regulating the marketing of food and non-alcoholic beverages for children. Promote physical activities through a life course approach and implementing the best by to reduce the harmful use of alcohol. Strengthen NCD surveillance by monitoring risk factors and determinants, outcomes of mortality and morbidity, and integrate the components of surveillance framework developed from national targets and indicators based on the WHO recommendation and WHA resolutions into the National Health Information System. Implementing intervention identified by WHO as best buys into the basic primary health package using WHO tools such as integrating approach to cardiovascular disease and diabetes with multi-drug therapy and aspirin to people with acute heart attack. Also improve access to safe, affordable, and quality essential services and technology for major NCDs. And lastly, just an overview of what the NCD's capabilities can be like.
Hi, my name is Fabiola Lopez, and I'm going to be presenting on critiques and solutions for global systems. Despite NCDs being a leading cause of death worldwide, they have not received the attention necessary compared to other illnesses. Global systems, including United Nations agencies, as well as multilateral, bilateral, and nonprofit partnerships, work to decline the rates of NCDs' premature mortality. UN agencies such as the World Health Organization, the United Nations Development Program, the United Nations Population Fund, and NCD Alliance are highly involved in implementing interventions worldwide. The WHO is a key factor internationally with a high level of leadership and coordination in efforts to promote and monitor global actions against the rising burden of NCDs. United Nations Development Program prioritizes NCD policy through UNICEF and UNFPA, which have recently increased their focus on the NCD topic and decided to increase NCD programs. UNDP has added NCDs into their health policy in order to increase developments and decline poverty that deepens disadvantages relating to health inequality and exclusions. This integration of NCDs into programs supports countries in the development of NCD investment in a partnership with the WHO. The other global systems, the multilateral actors, offer policy options for NCD prevention and care, while bilateral donors prioritize preventions. This graph shows the flow of development assistance for non-communicable diseases worldwide. NCD intervention receive funds from various sources. As you can see on the left side of the graph, government and private philanthropy are the main funders of interventions, followed by UN agencies, as well as bilateral and multilateral actors being among the highest contributors. UN agencies develop programs to disseminate NCDs worldwide. For example, the Global NCD Action Plan 2013 to 2020 and the Mental Health Policy Action Plan provided member states and international partners with a roadmap and many policy options, such as increasing tobacco taxes, reducing salt in foods, and promoting access to affordable medicine. Another example is that in the last decade, NCDs were not present in the Millennium Development Goals, or MDGs, but they are now included in the Sustainable Development Goals of 2030, where the SDG target 3.4 specifies an overall reduction in NCD mortality by a third. And the NCD Alliance, which was created in 2009 to target 4 specific federations, such as the International Diabetes Federation, the World Heart Federation, and the Union for International Cancer Control, and International Union Against Tuberculosis and Lung Disease, which were targeted to recognize that they share an agenda around the risk factors and had similar health system responses. Following this, in May of 2009, the NCD Alliance launched a campaign for United Nations High-Level Summit on Non-Communicable Diseases, which had a very high level of success. There have been many SDG initiatives throughout the world, but the pace has been slow. In order to move forward, the issues must gain wider attention of the UN, and solutions need to be reinforced and included in global and national responses. Data from multiple countries have reported that only 2 out of the 10 NCD progress indicators have been met by half of the 176 countries in the SDG initiative. For example, if trends from 2010 to 2016 continue, women and men in China and India, which are the 2 largest countries in the world, will have 4 to 15% reductions in the risk of premature deaths from NCDs by 2030, which is not sufficient to meet the target 3.4 of the SDGs. Also, only 17 countries are currently on track to meet the SDG target for women, and 15 are on track to meet the target for men. Pace of progress in most countries is uneven to achieve the SDG target. And among all countries, India has the highest rates of improvement. This graph shows the number of countries in which a cause of death must be declining with a fast trend to achieve the SDG target 3.4. The highest rates are among ischemic heart disease, which need to decline faster in over 120 countries for men. Challenges that are faced in the NCD framework are inadequate funding, where there's a lack of alignment between policy and investment priorities of the global actors. There's a low prioritization of NCDs, even though they are recognized as a continuously growing threat. The process worldwide is unevenly distributed, especially in low-income countries. It is important to consider NCD strategies to be based on local epidemiology and to have access to health systems that facilitate prevention throughout the population with a continuum of care, which is often a challenge in low-income countries. They're already facing high rates of infectious diseases, such as COVID-19. The COVID-19 pandemic continues to aggravate the prevalence and progress towards achieving the SDG goals. One example being it can interfere with treatment of NCDs. Another challenge is infectious diseases and epidemics, which are prioritized in policies and funding. And since NCDs are not recognized as a global security threat, they are not prioritized in these policies. They are not an immediate risk to others, therefore many donors and foundations do not prioritize them. They are also not mentioned in key policy documents that shape the foreign policy and development agenda in the United States, which may face more challenges. Solutions for challenges presented for NCDs are to invest in effective interventions, reinforce the government structure, improve prevention and evaluations, as well as research. It is also important to align policies worldwide, increase financing and lending for prevention and management, expand the NCD political coalition beyond the health sector, recognize NCDs as a global threat, as well as implementing strategies based on primary and secondary prevention, and a continuum of care is challenging in low-income countries. Therefore, including mechanisms for early diagnosis and treatment care for NCDs would prepare the health system to deal with other conditions, which can be achieved by creating additional financing in alliance with other programs. It would also be helpful to split the issues into 2 in order to target them more effectively. We will now cover the priority areas of actions.
Our 3 priority areas for action consisted of addressing tobacco control, healthy diets, and increasing physical activity. These areas were identified as playing key roles in the development of the most pertinent NCDs and should be addressed to impart the greatest change. To be comprehensive, a program for the prevention and control of NCDs must integrate policies designed to foster a societal environment in which people are encouraged to make and maintain healthy living choices, promote health literacy so that people can protect and improve their health, and provide health services focused on early detection and cost-effective management of non-communicable diseases and their risk factors. Population-based interventions include policy measures such as increasing taxation of tobacco and alcohol, reducing salt and saturated fat and eliminating trans fats in processed foods, and creating smoke-free and exercise-friendly public spaces. Among the risk factors identified as major causes of NCDs, dietary risk factors and physical inactivity are partially determined by individual preferences, but are substantially influenced by the manufacturing and marketing practices of the food industry and by the built and societal environments that permit or impede physical activity. The chart on this slide shows opportunities for prevention, detection, and treatment of non-communicable diseases in low and middle-income countries based on the level of approach. At the government level, we can see that prevention methods can include anti-tobacco policy, policies that promote reduction in salt intake, regulation and labeling of processed foods and high-sugar beverages, planning for safe, healthy environments that promote physical activity and limit the transition to sedentary lifestyle, and policies designed to mitigate the harmful effects of alcoholic beverages. In terms of detection, we can see promotion of awareness of non-communicable diseases, their signs and symptoms, and the need for early detection. And finally, at the treatment stage, we can see policies that ensure access to affordable essential medicines. At the level of healthcare system, we can find prevention to include intersectoral planning for health promotion, training of health personnel, including task shifting for detection and treatment of NCDs that include blood pressure and glycemic control provided by nurses or ancillary health workers. In terms of detection, we can find surveillance to determine the prevalence of risk factors and NCDs, facilities and equipment for low-cost detection of intermediate risk factors such as high blood pressure. And finally, at the treatment stage, we see facilities and equipment for affordable treatments, recognition of the need for both short-term and long-term treatment of NCDs. At the final level of approach, clinicians, prevention can include counseling of patients in risk factor reduction and treatment of tobacco addiction. In terms of detection, we can find evaluation of intermediate risk factors coupled with lifestyle and drug interventions to lower risk factor profiles, appropriate screenings such as detection of HPV. And at the treatment stage, we can find evidence-based treatment with affordable essential medications, procedural and surgical interventions if appropriate.